So the mask today that I'm wearing was designed by some of the staff at the Department of Health, and I appreciate that. And Dr. Smith has one as well, and we gave one to Eddie. So Eddie will have a mask now, perhaps to match one of his colorful ties. Thank you for joining me today, and I'm glad to be joined again by Dr. Smith, and then as well, of course, Secretary Preston, to make some announcements in reference to our economic recovery plans. And let me start by going to the board here, and I wanted to extend congratulations and happy birthday to a great World War II veteran, Louis Strickland. He's Technical Sergeant, U.S. Army Air Corps. Happy 100th birthday. He is currently residing in our state veterans home in North Little Rock, and his family can't be with him because of the COVID emergency. But the veterans friends and the coalitions are wishing him happy birthday in various ways. And he was there on Normandy on D-Day, and we ought to celebrate anybody who contributed to our country in that fashion. So happy birthday, Louis. And then I also wanted to mention that today I signed a state disaster declaration for 11 counties. This is Arkansas, Bradley, Cleveland, Dallas, Drew, Grant, Hot Spring, Jefferson, Lincoln, Ouachita, and Phillips counties in terms of their recent storm damage. And then I also signed a letter today, just now, requesting a federal disaster declaration for the tornado that occurred on March 28th that hit Jonesboro severely. We itemized almost $500 million in damages to the city of Jonesboro, which should be sufficient to qualify for a federal disaster declaration. But I want to mention that request is in, and I know that our federal delegation will be supportive of that request as well. In terms of our COVID-19 report, yesterday we had 2,465 cases. That is up 276 cases over the last 24 hours. That brings the total to 2,741 cases. Of the 276 new cases, 198 of those cases are in the Cummins prison unit. Again, this is just more of them being put into the system as we've indicated over the last couple of days. In terms of hospitalizations, we're up 3. We now have 104 hospitalized. We have an additional deaths, and we have 46 deaths at the current time. And if we'll go back to the charts, we'll just show it in the usual fashion. The number of COVID-19 cases in Arkansas by day, starting March 11, the first day of the emergency, continuing on to the present time. And you can see the two bar graphs on top of each other, actually. The white representing those in the settings of Cummins Prison, and the others are representing the general population. That includes the staff in the Cummins Prison there as well. And then if you go to the next one, you'll see the rolling averages, 7-day rolling averages of all new cases in Arkansas, and you can see where we are on that trend. And then the next one is the 7-day rolling average without excluding the correctional facilities, which looks a little bit different. But obviously with the increased testing, you're seeing some of those numbers of cases each day go up. And thank you. And that leads me to the testing discussion that's going on nationally and we've been engaging in Arkansas. Yesterday, in the last 24 hours, we've had 2,808 tests that have come in. Yes, 2,808 tests. And if you remember yesterday, I outlined our testing, and the highest day we ever had was about 1,600. We've been averaged about 1,000, and so I'd like to say this is because we had our 2-day surge, but I think it was just a result of the tests that are coming in from the commercial labs in a very large chunk over the last 24 hours. And so with 2,800 tests and with that increase, I think that is really a pretty good indication In fact, it's a 4.1% positivity rate overall in our tests, including our corrections facilities. And I've talked to enough governors to know that that's a low positivity rate, and but we've clearly indicates that we are doing more testing, more is being done. It just took a while for that to catch up. And that just wanted to put out another reminder to the public. If you go to the next one, Arkansas Surge Campaign, if you think you have symptoms, don't wait, get tested. If you think you have symptoms, don't wait, get tested. And so we're still encouraging today and then tomorrow. If you have symptoms, if you're worried about that, do your screening, call in at first. You don't just go in there to the emergency room or the hospital. You call in, you give them the information, and they'll tell you how to handle it if you believe that you need to be tested. We do want to, along with, consistent with the guidelines that Dr. Smith and his team have given to us, we want to be able to utilize our testing capacity in Arkansas and encourage that testing. And I do want to thank hospitals for their assistance in this. I've talked to a number of them, and they understand the need for this. They're embracing that. They're always worried about their supplies, but we've got to go ahead and get this testing done, knowing that our supply chain will continue to develop across the nation. I wanted to make a couple of announcements today. First of all, the dental procedures will be allowed to proceed on May 18th. Now, that's not May 4th, that's May 18th. And in the interim, Dr. Smith and his team at the Department of Health will be working with the industry associations on proper guidelines to make sure that consumers have confidence that we can have our particular protective measures in place. We're setting that as a goal. Obviously, if we're not comfortable with where we are, that can change, but we're setting that as a goal, a plan to reopen for those dental procedures on May 18th. The second announcement I would want to make, it leads to the reason Secretary Preston is here, is that our Economic Development Commission, part of Department of Commerce, has approved 246 bridge loans for struggling businesses in Arkansas that totals $5 million. That exhausts the amount of the funds that were utilized for that purpose, and these 246 bridge loans has retained almost 2,500 jobs, full-time jobs, and about 1,000 part-time jobs. And so we have about 100 loans that were applied for that look like they would qualify and could be approved if they were processed, but they're unfilled because we ran out of money. And so these are businesses that continue to be in need. And so I am approving today an additional $1 million that should be sufficient to meet the additional loans that are backed up and have not been fulfilled at this time. That will come out of our quick action closing fund money that is really designed to create jobs and to retain jobs. With that, let me recognize Dr. Smith for his comments, followed by Secretary Preston.
Thank you, Governor. I would like to give just a few more details on the numbers. As the Governor has said, we had an increase of 276 cases yesterday, of which 198 are from the Cummins unit and 78 are from what we consider the community. Those may include some workers at Cummins unit as well. That brings our total to 2,741. Of those, 1,763 are considered active. We have one new county, that's Fulton County. We have in the hospital 104 current hospitalized. That's up a net gain of 3 from yesterday. We have 25 on a ventilator. That's up 1 from yesterday. And as the Governor mentioned, we have now 46 deaths. That's up 1 from yesterday. We have 932 who have recovered. That's up 30 from yesterday, and that means that over a third of our total cases have recovered at this point. From the nursing homes, we have 34 nursing homes in which we're doing active investigations. We have a total of 176 residents who have tested positive, and that's up 2 from yesterday, and 102 staff at those nursing homes, and that's up 3 from yesterday. We have 285 health workers who've been infected, and that's up 10 from yesterday. I want to give a brief update on the Cummins unit. We are now at a total of 690 inmates who have tested positive. That's 3 more than yesterday. Now, again, I already said 198 of the new test results that came in, but those were inmates who were already tested previously and just are finally entered in our system properly. Among staff, we have over 30 staff that have tested positive. We are continuing to wait results for some of those tests, and that may increase a little bit tomorrow as well. From the Federal Correctional Institute in Forest City, we are up to 79 inmates who have tested positive and a total of 11 staff. I want to mention a little bit more about our testing. As the governor mentioned, we did have our largest single daily number of test results that came in yesterday at 2,808. Of those, a total of 4.1% were positive. Now, to give the big picture, to date, we've had a total of 34,745 tests, and of those, 7.9% have been positive. So even though we had this large increase in the number of test results that came in, we actually have one of our lowest positivity rates since we've been doing testing. I'm a little bit concerned about the 3-day increase in numbers from the community, and we'll be looking at that very carefully. Part of that, this last from yesterday, is that increase in the number of test results that came in. Even though the positivity rate was lower, just the sheer numbers means we had more positive cases reported yesterday. In looking at where those cases are coming from, there's a slight increase in percentage of those the last 3 days coming from northwest and northeast Arkansas, so we're going to give some particular attention there, look more carefully at where those cases are coming from so we can take appropriate interventions. And we'll be watching that very, very carefully, especially as we have our 2-day testing surge. We'll expect to have more results. We may see more positive cases, but we'll also be looking at the positivity rate. If that rate is remaining low, then that will be comforting, but we definitely want to find out. The purpose of the testing is to identify new cases, to interrupt the chains of transmission, to reduce the spread of COVID-19, and then ultimately to save lives. And I'm going to talk briefly about the dental guidance that we'll be providing. As the governor has mentioned, we do plan, if everything goes on schedule, if we are able to see a downward trend in these cases, that May 18th is our target date for resuming office dental procedures. Now, dental surgery is already covered under the directive for elective surgical procedures, but that requires more than would probably be appropriate for most office dental procedures. So we are going to put out a guidance document giving out the provisions for resuming non-urgent and non-emergent elective dental services. That will come out sometime later today. We'll outline all the things that dentists will have to have in place and give a whole broad overview of the staged approach. We won't go back to full everything on the 18th. It'll be a staged approach. As we get closer to that time, we will put out a directive that will specify exactly what will be expected to resume on the 18th. That'll be a shorter document, and it'll focus only on that initial stage. But what we'll put out today will be provisions that will be required for that to happen. And with that, I'll turn it back over to the governor.
And I want Secretary Preston to come, but I want to applaud him and his team, how hard they worked in building the systems and in making sure that the unemployment claims can be processed, an extraordinary number of those that have come in. So they worked very hard, but he wanted to give an update, and so Secretary Preston.
Thank you, Governor. Appreciate that, and appreciate the support of the entire DWS team and the folks on the front lines of our unemployment insurance, trying to get the help out to everyone there, and then our entire Commerce staff, who is obviously trying to help commerce in the state, trying to push the ball down the road a little bit further if we can, but then also recognizing the need for the unemployment insurance. So we're all hands on deck trying to work through that. Just a real quick update for everyone on the unemployment. As you've probably seen, 26 million claims now in the United States. In Arkansas, we're up to 170,000 claims that have been filed. As the Governor alluded to, we are working hard to make sure our systems are built and that we're handling and processing those claims. The good news is that we are able to process and handle them. On the pandemic unemployment assistance, this is where we're getting a lot of questions still, and this is part of the CARES Act. That's again for those self-employed, the freelancers, the gig economy workers. We have made significant progress in building that system. We hope to have that set up and ready for intake by the end of the month. We're estimating anywhere from about 125,000 at a minimum and beyond who are going to file for that pandemic unemployment assistance. So we want to make sure that that system is fully capable to handle that large volume of people coming in and trying to process that. But our team has been working around the clock, and especially those on the front lines in our UI offices around the state who are still dealing with people in person and trying to process claims. It's because of their hard work that we've been able to process the claims and get the payments out to everyone who is in need of them. An update for tomorrow, just to for everyone who is watching, our EasyArc site is where you go to file online. We are taking that down from 6 a.m. until noon tomorrow, and then it should be back up around noon. And this is to move it to a larger mainframe, so we want to be able to handle that additional rush of claims that we're seeing. And this is going to allow us to do that. Hopefully it'll stop from any intermittent crashes that have happened with the additional capacity. Right now we're currently still, even though we've added space to it, we're running up against a capacity issue. Moving it to a bigger mainframe is going to hopefully alleviate that and then prepare us as we handle that pandemic unemployment assistance that will be coming in. And then also additionally, our call center starting Sunday will now be 7 days a week. So we're going from 6 to 7 days a week. So you can call that number 844-908-2178 to file a claim, or if you have questions, please call there. So there'll be an additional day on that to hopefully alleviate some of those calls. Switching gears real quick, and again, thank you, Governor, on the bridge loan program that turned out to be a very successful program, and as you mentioned, helped retain nearly 3,500 jobs in the state of Arkansas, and got some immediate business assistance to those businesses who are in need of it as they were waiting for the payroll protection program or another SBA funded program to come through. We're excited to see that the Congress has approved some additional funds into the payroll protection plan as well. That's going to be beneficial to Arkansas businesses. On the first go-around, we had 22,000 businesses in Arkansas who were able to apply and get approved for that program, totaling $2.7 billion. We still had about 13,000 businesses, however, who were in flux waiting for additional funds, and that accounted for about $1.1 billion. So now that that's been funded and approved, we hope those funds will start flowing again to those businesses in the payroll protection plan. So we're excited about that, and I appreciate the team's hard work to turn around the loans that we did in our office in less than 2 weeks. To process that many was just it's a daunting task, but the team really knocked it out of the park and being able to do that. Switching gears one other time to another entity within the Department of Commerce is our insurance department. And our insurance department wanted to make sure that they get the word out to those who employer-based health programs that may have been lost in the last 60 days. If you have lost your job, lost your health insurance because of this pandemic, it's possible that they might qualify for a marketplace qualifying health plan. The insurance department has a toll-free number available for people who have lost employer-based coverage to sign up with a health insurance with a licensed marketplace navigator. The number is 844-355-32 3262. You can go to the Arkansas Insurance Department, to the Commission's website, and get that information. They'll be doing a campaign to get that word out as well. But a big thank you to Commissioner McLean and his team for working diligently to see that happen and make sure that those who are impacted by the loss of their health insurance plan have an option. Governor, thank you for that. We appreciate it. I'll turn it back over to you.
With that, be happy to take any questions.
On the surge campaign, the Arkansas Hospital Association sent out an email to their members basically complaining that they weren't consulted about the campaign and that some hospitals didn't have adequate supplies of testing equipment. So I just wonder if you want to respond to that and if you've seen any problems with them being able to carry out the surge.
No, I haven't seen any problems. We have worked directly with hospitals. I have talked to numerous hospitals myself, and when we realized that there, in many of the large hospitals particularly, there was a capacity to do more, and when we changed the guidelines, this 2-day surge made a lot of sense, and so we announced that. We're working with the hospitals. I've assured them if they need additional supplies for the next 2 days, we will hand deliver them to them. We will make sure that they have those supplies. And this is a time that we pull together to get the job done. And we're delighted to work with the hospitals, and they've been very responsive to us. Yes?
Did you let them know before did you talk to hospitals before your announcement yesterday?
I talked to numerous hospitals. I did not talk personally to all the hospitals. And of course, Dr. Smith, his team works regularly with the hospitals.
Was there a complaint that they were surprised?
Well, I'm surprised every day when I wake up. There's always something happening. This is the kind of thing that we have to move with our testing capability. I think everyone understands that we don't have enough testing to do 10,000 as they've done in some states, but we do have the capacity to do more. And that's illustrated by the fact that we've done 1,600 previously in one day. We are down at 1,000. I asked that we increase that to 1,500, which is still 100 less than our highest mark that we've had before. So these are not an unreasonable objective, and we realize that some of the real hospitals are not going to have that kind of demand. They're not going to have that kind of an impact. But whenever you look at our capacity in Arkansas, our testing sites, if somebody needs to have a test and they qualify based upon their symptoms, sufficient number of hospitals to get an idea as to where we were, and we proceeded with that.
Seeing the 3-day uptick in positives, does that kind of give you a little pause about opening things back up May 4th?
It doesn't give me a pause at when you say open things back up on May 4th. Now, what we've done is that we have set timelines for review of specific industries and to lift restrictions on May 4th in some areas. As you can see from our announcement today that May 18th is a day we're looking at for dental procedures, that means you're not completely opening up on May 4th. That means you're not lifting all the restrictions on May 4th. And here again, it's very similar to what we did on the outset when we had enormous pressure to shelter in place and follow the national admonitions and pressure points. We took a targeted approach to what we were doing. Well, the same thing, there's a lot of pressure. Well, lift everything at once, as some states are doing. We're taking a more measured approach that is based upon the information that we have that's unique to Arkansas, and making judgments industry by industry. And so it's not all open up on one day. It is, let's look at how we can have a measured approach and phase in some of these industries that are desperate to go back to business, but they also want to be cautious in terms of building consumer confidence. And so I think we've got the right approach, and we'll see what we're able to do on May 4th. Is there a question remotely?
Hey, Governor, this is Andrew with AT. Going to the testing, with the demand that you're seeing at this point, do you think there's going to be capacity for people who are going to be getting tests ahead of elective procedures? And the ACLU of Arkansas has put out a statement saying that the testing requirement, given the testing availability amount, that could effectively still ban surgical abortions here. Once you've got a response to that.
Well, I think there's two questions. I'm going to let Dr. Smith answer, add to this. But the first part of the question is the testing requirement for patients coming in for elective procedures too burdensome? And the answer is, I think it's very prudent in this healthcare emergency. We don't want to have a patient come in that's positive for COVID-19 when that kind of surgery and procedure can be put off to a different time. And so it's also something very important for us to know, that kind of specific information. And then the second part of your question was about how this impacts an abortion provider. Let's just review where we are. We put out a set of guidelines for all of our elective procedures in Arkansas. We put out the same guideline for our clinics, our hospitals, for elective surgeries. The abortion provider, through the ACLU, took that to court, and they lost it in the 8th Circuit Court of Appeals that said this is reasonable action for a state to take under the healthcare emergency that we're under right now. And that case was won by the state, and then they come back and they say, well, even though you're going to open it up now to all, under certain guidelines, all procedures for all clinics, then they're objecting to that. In other words, they just don't want to follow what we're having to do for all of our clinics that engage in elective procedures, and I think that's the right approach that we've taken. Dr. Smith?
Yes, I want to point out that in the President's plan for opening up America again, elective surgery is not something that is recommended until you hit phase 1. We're not even there yet. We are hopeful that May 4th will be phase 1, but we have come up with some very, very strict guidelines for certain types of elective surgical procedures under certain conditions, which we believe can be done safely. And those include, among other things, testing each patient within 48 hours of the procedure, so that you're not bringing someone in who has asymptomatic shedding of virus into that kind of setting, into a hospital or surgical setting. And these are very specific conditions that we believe will be able to allow certain providers to do certain types of cases safely even before we hit phase 1. Well, of course, I've gotten a lot of questions on that. Well, what if we can't get testing done within that period of time? Well, not every facility is going to be ready to do that. They also have to have adequate supplies of PPE. They also have to have robust infection control procedures in place. So not every facility will be ready to do that on Monday, on the 27th. There are others who will have to wait till later when we relax some of those guidelines as we see our case numbers going down and down. Second question I have is, well, how about Monday cases? Can we go longer than 48 hours for a Monday case? Well, 48 hours is 48 hours. As far as I know, COVID-19 doesn't take the weekends off. So this is what we need to do. This is a minimum standard for trying to make those procedures safe. And another question that I've had about these procedures is, does this apply? Why doesn't this apply to the emergency cases? Why don't you require testing for COVID-19 before the emergency cases? Well, I think you can figure that out. If it's an emergency case, you don't have time to test them. Now, it may be appropriate to test them after you've done the procedure, but that's why that doesn't apply to emergency cases.
When you, Dr. Smith, when you're talking about dental procedures, are you talking about like May 18th, people can go get their teeth cleaned at their dentist? Is that what you're talking about? Or?
When we're talking about office dental procedures, yes, we're talking about a number of procedures. Some of them will be appropriate, and others will need to wait until later on. Particularly, there are some procedures that generate a lot of aerosols, and we want to avoid that in this staged approach. So come May 18th, it's not going to be everything, but it will at least allow some office dental work to occur under certain conditions.
So can we enter into phase 1 without a 14-day decrease in cases?
Well, we're going to look at a lot of different parameters, and you know, we've had 2 or 3 days of increase, and if that continues to increase, well, I think we'll have to rethink our strategy. If it turns around and goes down, and we have an overall decrease over the 14-day period of time, then I think we can cautiously proceed. You know, if it's somewhere in between, we might have to make some decisions that are, you know, based on the knowledge we have, not based on all the knowledge we wish we had.
Go ahead.
The CDC added some symptoms like chills, sore throat, loss of taste or smell. Will people with these symptoms be eligible for testing in Arkansas?
Certainly they would. The symptoms that we put there, cough, fever, shortness of breath, are the most common symptoms. There are other symptoms that are maybe somewhat more specific, that loss of taste and smell, but certainly not everyone has that. So we don't want to require those symptoms of people, but we want those who are likely to have COVID-19 or at risk of having it to be tested, because if we know people are positive, then we can have them self-isolate, we can do the contact tracing. If we don't know, we can't do that.
Let's go remotely. Is there another question remotely?
Good afternoon, Governor. I think this question is for Dr. Smith. About an hour and a half ago, Politico reported that the governor of Maryland communications director says they've received over 100 calls from Maryland residents asking about using antiseptics and disinfectants per the president's comments yesterday. I'm curious if any Arkansans have asked that question of the health department.
Neil, where did you come up with that question? Dr. Smith.
I read it on Politico, and Governor, I think the question is instructive because it would tell us that at least in Maryland, some people are taking advice not from healthcare professionals.
This is Dr. Smith. I've not received any questions about injecting disinfectants or light or heat, and I'm not aware of any inquiries that have come to us as a department, but I'll check to make sure over the next few days whether we're getting questions like that.
That was a lawyerly answer. Yes.
Have you seen any indication about whether the surge is working? Like, are more people coming out to get tested? Or?
Well, shucks, we had 2,800 tests today. The answer is, I think there's some indications that there will be an uptick in the cases. We won't know this for some time because as I talked to some of the hospitals, they were thinking that, well, we need to use our in-house testing capacity. And I said, no, you can use your commercial lab for this. And so that might mean we won't get the test results back for 24, 48 hours. It depends upon how quick a turnaround that is. And so we won't know completely as to the response to this surge, but anecdotally, you know, from my conversations, I think there are more that are going in because of the fact that we expanded the criteria a little bit more broadly, and we're you know, urging people to take advantage of this opportunity over the next 2 days. So we'll see, but I'm hopeful that we'll have an increase in testing.
What hospitals have you been able to talk to about their supplies?
Well, I've talked to St. Bernard's Hospital in Jonesboro. I've talked to Baxter Healthcare System in Mountain Home. I've talked to Mercy Healthcare System. I've talked to the Gravett Hospital. Obviously, UAMS is here. We've talked to Baptist. And so, it's a pretty broad range, number of hospitals, a few others. Jack, I see Representative Lademan. Good to see you, Jack. And I think Senator Irvin was here earlier. But anyway, Jack.
Yeah, thank you, Governor. I want to thank you for signing that application, disaster application for Jonesboro. I've had a lot of destruction there, as you saw, so really appreciate that very much. One person, thank you for that. But also I had a question related to that. As Dr. Smith said, the number of cases in Northeast Arkansas have gone up, and I was just curious, could that be related? We had a lot of contractors come in there. There was an article in the Jonesboro Sun today about the number of contractors that are staying at hotels there locally, and they're coming from other counties, even other states. So they're coming in there. Could that be one of the reasons that our cases are going up? Could that be spreading through those people coming from other districts, other states? And is there any suggestion, they come in, they stay in the hotels, they go to work, they're not going into a place where they can really be tested. Is there any suggestions on how we might, reduce the impact of that?
I'll let Dr. Smith answer, but let me, first for everyone, the question relates to Jonesboro and the contractors that might come in from out of state to help recover from the tornado damage. And as you know, we've tried to worked hard to discourage and even put signs up to prohibit recreational out-of-state travelers from coming into Arkansas. Obviously, if the contractors are coming in to respond to an emergency, they are exempt from that requirement. We recognize those are essential workers that need to travel. But obviously, we expect them to take their social distancing seriously, even though they're responding to an emergency, as I know the Jonesboro community has done. But Dr. Smith, do you want to add to that?
Yes, thank you, Representative Lademan. And Governor, I agree that there is always a risk in people coming from other states with perhaps higher risk of COVID-19. It's important that they do the physical distancing and preferably wearing the cloth masks when out in public. I think, though, in the Northeast region, the way we categorize them as public health regions, Crittenden County is the one that has is the county within that group that has the greatest number of cases, and that is largely due to its proximity to Shelby County, Tennessee, and Memphis. And so I think probably more of it is spillover effect from that than other things. But certainly you've highlighted an issue. Anytime we have people coming into the state, we need to be cautious.
For some reason, this number of, I guess, must have been 5 weeks ago, you guys said that 6 to 8 weeks from that time, you expect the number of cases to peak at about 3,000. And then you kind of walked away from that. When do you expect the virus to peak here?
Well, just to clarify, we had a 2-week model that had us being at 3,500, and that was April 10th, and we're not even to that now. So that model was obviously not very good. That was our in-house model based on our data and based on what we thought would happen, but we bent that curve. There have been other models that have had us peaking anywhere from today, which was April 24th, to May 2nd. Now, if you look at the actual shape of our curve, it's not been like a mountain. It's kind of had some ups and downs. It's a little hard to identify a peak, I think, in this case until you're well past it. We were going kind of steadily downward for a while, and then we have had a few days of an upward trend, and so we're not exactly a shape. Our curve is not really the kind of shape that it would be easy to model mathematically. And so I would say that we're at a point where we need to look at how things are going day to day and have some situational awareness, identify where we're seeing new cases and what we can do to interrupt those chains of transmission more than relying on a particular mathematical model.
Dr. Smith, are we seeing any headway in the prison system, or are there a number of recoveries? Are there any hospitalizations from the prisons?
Well, I'm going to talk specific about the Cummins unit. They have done really an amazing job. They've worked very well with our team. They've basically divided people according to their status, both their testing status and their exposure status. We're in the process of basically testing pretty much all of their workers so that we know. And not only that, they've actually set up a field hospital within their unit so that they can take care of the lower acuity patients without having to move them out. Of course, if they get sicker, they will have to be sent out. I know some of them have already gone to UAMS and some other hospitals, but most of them they should be able to take care of in the field hospital so that we don't have to have as much movement of people in and out.
Do we have numbers on recoveries and hospitalizations?
Well, the recoveries, remember we defined that by 7 days after the onset of symptoms, or in the case of those who are asymptomatic, 7 days after the positive test. It's been less than a week, so we wouldn't have very many recoveries, if any.
Yes, ma'am.
Governor, are you considering with other states opening up and Arkansas working towards opening up, extending the restriction on recreational travelers from outside other states with the summer coming up and everything?
Are we considering lifting that? Well, certainly that has to be on the table to look at, as well as the other restrictions. For example, there's discussions about our Buffalo National Scenic River Park, and that is a national park, and so if the restrictions are lifted on that, which is a national federal decision, they have to be open to national and guests from all the states. And so that is a consequence of that. But our state parks are a draw for anybody from out of state. They come here. It's one of our big revenue drivers in the state of Arkansas. And we have discouraged that, limited that, actually prohibited that. And so we will be working with Secretary Hurst, but also our Economic Recovery Task Force that's examining that very specific question. And I think you can see, again, from what we're doing, that this does not have to be a May 4 or nothing category. I think we can look at this phase by phase as to what's the right time frame. And I expect that you can see in the future that we'll set additional announcement time frames and decision points for whether it's that kind of travel or state parks or other industry sectors that we need to address. Is there anybody else remotely that has a question?
Yes, Governor Hutchinson.
No. Go ahead, sir.
Sorry, this is Chad Muir with KNWA, Northwest Arkansas News in Fayetteville. Thanks for taking our question. As you mentioned, the White House recommendation of a 14-day downward trend before reopening is just a recommendation. The state has flexibility to set its own guidelines. So what is the specific criteria based on the data you need to see before continuing with phase one?
Well, Dr. Smith and I have talked about this, and there's a number of different data points that are important in making that decision. One is the hospitalization rate. Another one is the cases that we have identified. It is our hospital capacity to make sure we have adequate hospital capacity. It is our positivity rate, which is one of the criteria that the White House set out. It is the availability of our personal protective equipment. It is another evaluation is as to how capable the industry is in putting forth and adopting sufficient health guidelines to give the consumers confidence, but also to protect the public health. So there's a multiple different areas of criteria that goes into that decision points, and we weigh them all. Dr. Smith.
I agree. When you say a 14-day downward trend in cases, there's lots of ways to measure that. Does that mean that every day in those 14-day period of time has to be lower than the day before? Well, at the levels that we are at, a small cluster can cause an aberration in our curve. And so we're looking at overall averages, we're looking at a general trend. Obviously, if we have cases increasing every day, then we need to rethink that. If we've sort of, like we are, where we have some up days and some down days, then it's a more challenging decision. We need to see where are those cases occurring. What have we done to address those situations? If we're seeing a general downward trend, which I'm hoping we will, then I think we can be comfortable moving cautiously into the next stage with partnership with the industries that we're talking about reopening to make sure they put in place precautions that will minimize the risk of COVID-19 spread within their facilities.
And then the second question.
Is there
Go ahead.
Sorry, I just want to follow up on that. Is there a specific number of days for the trend, or a specific hospitalization rate, or any target number that you're hoping to see in particular?
No. For example, you talk about a 14-day trend. What happens if you go 10 days and then the last day you have an uptick? Well, I don't think that means that you cancel all the plans. You have to measure it depending upon where that the reason for that uptick. Was it in a confined area? Is it indicate community spread? So those are factors that you have to weigh. As we get closer, if we have more specific data that we want to share and criteria that we're able to, we will do that with you. Then I think it was a second person that was trying to ask a question remotely.
Yes, Governor. Naun Dominguez here. Do you have plans to increase the number of testing again in the future?
Okay, the question is, do we have plans to increase the number of the testing in the future? And the answer is yes. We want to be able to increase the testing along with the 4 guidelines or priorities that our testing working group recommended that we outlined yesterday, and that includes both expanding the testing for testing positive for COVID-19, but it's also the antibody test that we hope to develop in the future. Dr. Smith, did you want to add to that?
Yes, I just want to provide a clarification. The strategy that was laid out, the 4-point strategy, is really more or less permanent strategy. The 2-day surge is a focused time to try and ramp up and utilize our testing capacity more fully, but those strategies will remain in place. Specifically, I want to provide some clarification on the 4th one, the antibody testing. The antibody testing is not at this point useful for clinical care or diagnosis, so I would not recommend anyone to go out and get an antibody test. An antibody testing scheme or strategy will help us to understand where COVID-19 has spread in the past in our communities, and more of a research tool for us to better understand what's happened, kind of like the rear view mirror. You wouldn't want to try and drive a car just using a rear view mirror. So it would not be appropriate to go out and get tested with an antibody test if you think that you may have COVID-19 infection. Now, if you thought, well, you know, a month ago I got sick and I got better, I never got tested, I'm kind of curious, was it COVID-19? Well, you might ask your doctor, should I do an antibody test? If it seems appropriate, that you could do that and see, well, I did have it in the past, but it's not going to tell you what you have right now.
One last question.
Those antibody tests, if you did them to determine the people who had been sick but not tested, that they actually did have COVID, would that change the way doctors look in the hospital at who people coming in for treatment?
That information would be helpful, but it wouldn't really change what we're doing now. It wouldn't change probably what we are planning on doing in the future. We know that there are asymptomatic cases, people who are infected but don't have symptoms, and that's why we've extended our testing criteria to include those who have had potential exposure either through travel or through contact with a case. So that itself wouldn't change. Now, some people have some ideas about antibody testing that are not really proven or fully proven. One idea is that if I have a positive antibody test, well, now I'm protected. I've got antibodies and I can't get it again. We don't know that, and in fact, there are some cases from South Korea where people have had either a relapse or a reinfection. So we don't know that those antibodies mean that someone is protected. So I don't want people to misinterpret the results of that test and put themselves at risk for potential reinfection.
Help doctors have a broader picture of what COVID looks like if someone comes into the hospital, just if they keep track of that kind of thing. And do we have point of care testing yet?
Offline on that, or the doctor will be available for an additional question. Thank you very much for your attention today. Thank you.